Good evening, everyone. My presentation tonight is on ultrasound-mediated drug delivery. So basically, that's a technique where we're able to enhance the delivery of therapeutic drugs to specific target areas in the body. And essentially, we'll just be discussing how we're able to harness the power of sound waves to improve how drugs are transported, distributed, and absorbed in tissues. Now, just to start off, why is this important? Well, drug administration has some difficult hurdles, and that includes obviously getting the drug to the target location, and then also maximizing the efficiency with which the drug is given or appropriately giving the correct dose. And ultrasound can actually help with those issues. So some of the key advantages to ultrasound drug delivery include ultrasound is a very non-invasive way to enhance the drug delivery. Obviously, we know, ultrasound doesn't come with extra radiation or additional procedures, right? It's very localized in terms of precise spatial area, and we can actually increase the efficiency of existing drugs. So we don't even need to, sort of invent new drugs. We can just use the ones we already have. And we'll also look at how ultrasound can help us overcome those biological barriers and some different applications that it can be used in. So just to give you an outline to kind of keep things clear in your head with this presentation, the first section will be on the mechanisms of sort of on a cellular level. How is it that ultrasound is actually helping the drug delivery? And then part two, we'll look at applications in which this is used. So with that, the four mechanisms we will look at tonight include localized hyperthermia, sonoporation, cavitation, and acoustic straining. So looking maybe at more of sort of a tissue level, we can actually use ultrasound to induce localized hyperthermia. And that involves, the tissue will increase in temperature to about 40 to 45 degrees Celsius due to the ultrasound energy absorption. And that has a number of really positive effects. The first one being you get blood moving to that area, which is going to help the drug move to that area. It enhances the ability for the drug to leave the bloodstream, which is helpful in targeting the cells. I don't know, I'll move this here. So right here you can see we have a sort of a capsule and the drug molecules inside. And in some circumstances, we can actually have thermosensitive carriers that will release the drug when they arrive at the target area with the target temperature. So that could obviously be very, very useful for making sure your drug gets to a very specific location. And then also, you can use this localized hypothermia will also just make the surrounding cells, make their membranes a little bit more fluid, allowing for diffusion of those drugs. So now going down a level, so this is more of a tissue level, we go down a level, we can look at sonoporation. And this is basically how does ultrasound actually help the drug or the target molecule get inside the cell? And this is the process by which that happens. So you can see here we have our ultrasound, and we have this critical component here called microbubbles. These microbubbles are located all around the cell. You can either inject them or they're just sometimes naturally available. But the ultrasound will cause these microbubbles to oscillate and vibrate up and down. And those forces will create these temporary pores or openings in the cell membrane, which will allow larger molecules, larger maybe proteins or whatever it is you're trying to get inside the cell. It'll allow those temporarily to get in. You can see how that'd be really efficacious for maybe a drug that's having difficulty getting inside the cell, right? You can increase that efficiency through this method. So that's from the cellular view. We're going to dive a little bit deeper and look at, okay, so we have these microbubbles and they're kind of bouncing around and helping the drug get in. How exactly is that occurring? So we can see here, there's basically two key methods. Cavitation is the overarching idea, but you have stable cavitation and inertial cavitation. And they both refer back to those microbubbles we were talking about earlier. So in stable cavitation, we have the microbubble is going to be vibrating, oscillating up and down, just like we mentioned earlier. And it's going to create these little micro streams, just sort of this circular centric fluid flow. And that circular flow that's created on either side of the pore here is going to kind of suck. You can see the drug molecule kind of getting sucked down in there, and getting inside the cell. That's obviously very useful. And then on the other side, we have inertial cavitation. So this is when we have maybe higher amplitude waves that we're administering, and this will cause the bubble not to just sort of oscillate. It will be oscillating, but it will be more extreme. So the expansions and the contractions of the bubble will be very intense, and that will create sort of like little mini explosions. And they say they'll create these little microjets, which will kind of push the drug inside. Now, again, why would that be useful? Well, we can look on our next slide here. These circular like fluid flows that are occurring right outside the pore, those are created by the ultrasound waves, are helping drive that. And these circular flows will kind of suck those drug molecules inside the cell. And that's really helpful because typically we just kind of wait around for the drug to sort of like naturally diffuse into the target area. But if you're able to find a way to kind of suck it in there, right, that's always going to be faster than sort of natural diffusion and ultimately make your drug more efficacious. Maybe you have to give less drug now, and then you don't have as many side effects in your patient. Okay, great. So now we've kind of learned from sort of a tissue down to cellular level of, how is it that ultrasound is really causing this to occur? Now we'll look at some applications as to where these techniques come into play. So the first is obviously cancer therapy is huge, and this has been used. There's a couple of different methods, go by different names, but the first one here that's mentioned is high intensity focused ultrasound, and this method is mostly focused on utilizing that principle of localized hyperthermia that we discussed just previously to this, where this ultrasound will cause localized heating that can help destroy the cancer cells, and then also make the tissue more available for the drug to advance its way in there. It's actually been approved for prostate cancer treatment on certain individuals, and it's currently being studied for other types of cancers as well. Then you have low intensity pulse ultrasound. That technique more so relies or focuses on sonoporation, which is again the opening of those cell membranes. It's very similar. Both of them are very similar, but it's kind of one is focused on one hyperthermia, the high intensity focused ultrasound, and the low intensity is more focused on the sonoporation side of things. Also very useful for helping get the chemotherapy drugs inside the target cell. And then I just added this last one here, immunotherapy enhancement, kind of a new field. I think a lot of maybe unanswered questions here, but there were some interesting studies about how ultrasound could convert cold tumors, tumors that don't respond well to immunotherapies, how ultrasound could convert those from cold to hot tumors, tumors being that do respond well to the immunotreatment. I think there's maybe, like I said, a lot of still unanswered questions there, but very interesting to learn about. Over here on this figure, you can see the growth of a cancerous mass, and in this study here, they're actually able to decrease the growth of that mass through ultrasound treatment, along with their treatment of choice. So we'll look here. We also have possible cardiovascular applications as well. In this case, we can use ultrasound to break down blood clots, and by sort of breaking those into smaller pieces, we can increase the surface area of the blood clot, or maybe an atherosclerotic plaque. We can increase that surface area, which will allow the drug to more effectively interact with that. In fact, in this diagram here is kind of showing a blood clot. We introduce these magnetic microbubbles, introduce the ultrasound, those microbubbles bounce up and down like we were saying, and that helps break apart the blood clot. And then your effector drug molecule can come in and help do additional cleaning as well. So obviously really important here. And then finally, we'll wrap up here with transdermal drug delivery. Ultrasound can be used for this as well. So in this case, you have a topical drug. Typically you'll just apply it to the skin and wait for it to sink down. In this case, you can actually apply ultrasound over it, and those vibrations, that movement, will help create that cavitation we were discussing earlier and allow the drug to pass through the epidermis down into the dermis and localize to its area where it needs to be. So that is the end of my presentation. Thank you for your time, and here are my cited sources.